Hello, my name's Jenna, and today I'm going to be presenting my project about access to vaccines and healthcare providers in rural Africa. So, the first thing that I want to talk about is what an acute and preventable disease is. An acute disease is a disease or disorder that lasts a short time, comes on rapidly, and is accompanied by distinct symptoms. A lot of times we can think of these as like food poisoning or something along those lines. And why is there such little access to prevention for these things? In rural Africa, there's often a much more difficult time reaching and providing funding for these services. So a lot of people aren't able to get routine healthcare. So my thesis is that people are dying in rural Africa because of lack of access to acute disease prevention, such as vaccines and regular access to healthcare providers. So there is a wide lack of vaccines in Africa, specifically sub-Saharan Africa. A lot of the lack of vaccines in these low and middle income countries account for 2 million deaths each year, and 2/3 of these deaths are children under 5. This fact is what made me reach out to UNICEF for my letter that I had to write. An example of this is that the hepatitis B vaccines are just now starting to be used in Africa when they were approved 2 decades ago for children. And over 99% of the 440,000 annual deaths from rotavirus-associated diarrhea and 93% of the 260,000 annual deaths from cervical cancer occur outside the 60 wealthiest countries. And a lot of times, this ends up being in these very rural areas. So there's also a huge lack of access to adequate information for healthcare providers. We kind of have a luxury in the West of being able to access these electronic journals, get super up-to-date information on new medical practices, but people in rural Africa and really any rural developing country just don't have access to these. They actually have very little access to basic medical information. There's been very little progress made in meeting the information needs of providers in these countries, and a lot of times this is due to the unstable internet connection that they have, or the lack of internet connection at all. Going back to Western medicine again, we tend to focus a lot on innovation through technology rather than the overall effectiveness for healthcare workers. And the people in these rural places don't have the technology to be focusing on these. They just need effective medicine that can help reduce the mortality in these places. The information poverty is really worsening the public health emergency that's already occurring there, because they already have such little access to resources that lack of access to information is only making this issue worse. The number of healthcare workers is also critically low, especially in these rural areas. If we think back to the video we watched about maternal mortality, that's actually what made me think of this, because there was like one doctor for multiple miles, and this can lead to death. Like, this is very dangerous for the people living in these areas to not have access to medical providers with current medical information. So a couple of examples of this were a study from the Kenyatta National Hospital in Nairobi. They found that 56% of the 130 doctors working there expressed a need for further training to deal with psychiatric conditions. And when they quizzed people on the type of care for an umbilical cord, 50% were incorrect by international standards. But this was in line with what the Nursing Council of Kenya was teaching, which can help show us the lack of current information that they are receiving. So, for the lack of healthcare providers in rural areas, I quickly talked about this in the last slide. It is very, very difficult to see or even contact healthcare workers in these lower income countries. And in one study I read that rural South Africa, there's a high prevalence of HIV and AIDS, tuberculosis, hypertension, and diabetes. And they also have a very high maternal mortality rate of 133 deaths per 100,000. And when you have a high prevalence of these potentially deadly diseases and chronic diseases, you need to have regular access to healthcare providers to help keep these in check. Because many of these diseases are treatable, like tuberculosis, hypertension, diabetes. There's treatments for all of these that could very much help reduce the mortality rate in these places. There's a deficit of 2.4 million healthcare workers in sub-Saharan Africa. And to put this in perspective, there's 2.3 healthcare workers per 1,000 in Africa and 24.8 per 1,000 in the US. And many people talk about in the US that there's a shortage of healthcare workers, but there's about 10 times less in Africa. So if you really think about that, that's scary to think about. So how does this apply to environmental justice and racism? Rural areas have a much harder time getting resources. And these lower income countries often have a much higher rate of environmental hazards that are there because industrialized countries often dump their wastes into developing countries. We can see this with scrap yards a lot. Like, an example is with the fast fashion industry in the United States. A lot of those clothes just get thrown out immediately, and even when you donate them, a lot of them end up going to just dumps in developing countries. And these can cause a lot of health hazards for the people living there. Globalization and industrialization are two major reasons for this environmental injustice. Like I said, like the fast fashion, that has to do with globalization and industrialization. So that's a good example there. And the increased hazardous waste in these rural areas can lead to higher rates of certain acute and chronic diseases. So, for the other side, the vaccines, there was a follow-up study on the effects of the DPT vaccine, which is diphtheria, pertussis, and tetanus, and polio vaccines, that seemed to have a slightly increased mortality of 1.84. But this study also only took place in Guinea-Bissau and was published in the year 2000, which was 2 decades ago. And it was not done in any other place that was not a developing country. So, and then for the information for healthcare workers, many still have access to the internet. It's not a internet wasteland where they can't access it at all. 84.2% of households in South Africa have a phone, so there's a good chance that a lot of them have access to the internet. And many providers can discuss how to treat patients better through online forums. A lot of times they don't need access to new journals, because if they have access to the phones, they do have access to the forums. And there are always the textbooks and local journals to learn from if they need to reference something. So my response to the vaccine study, there was a very low response rate in this study. It was 66%, and it was only done in one country with a fairly small sample size. The mortality was also shown to be only slightly statistically significant, because 1.10 is considered statistically significant. But in the overall concept of things, this would likely not be applied to anywhere else. For the internet access, a majority of providers actually said they would use, quote, Western methods, but many don't have access to these internet articles online. 62% of surveyed East African surgeons said that they would change their practice to use these Western methods, and only 11% of these surgeons only use local journals when getting their medical information. And this survey also found that they prefer electronic journals over textbooks because it gives them a much more up-to-date view of medical information today. And I have the same fact that I had when I was talking about the lack of information, about how 50% of information for the umbilical cord was incorrect by international standards, just to give another view into the lack of information that they have. So in conclusion, people are dying in rural Africa due to this lack of preventative medicine and healthcare providers. Vaccines are a huge part in preventing deaths in children under 5 and reducing the severity of disease in adults. We can especially see this right now during COVID because the vaccines that are coming out do correlate with declines in the numbers of people who are diseased. And just a personal story that I thought I would throw in. My grandmother actually got vaccinated and still contracted COVID in the hospital, but she barely got sick from COVID. Like, she was in the hospital for something completely different. She just happened to test positive for COVID. But she has asthma and AFib, so she almost definitely would have died from COVID if she had not been vaccinated. So that just shows how vaccines can help reduce the mortality greatly, especially in these places that don't have regular access to healthcare providers. Vaccinations do prevent more than 21 million hospitalizations and 732,000 deaths among children born in the last 20 years. And the life expectancy in sub-Saharan Africa is 61 years compared to 79 years in the US. And a lot of that has to do with the preventative medicine and access to providers in the US compared to Africa, specifically rural